are going to talk about HIV, Leishmania co-infection in Ethiopia. Thanks.
Thank you. I speak little Spanish. You have spoke Spanish. Muchas gracias for giving me this opportunity to speak in your auditorium, especially Professor Abati and my Ethiopian colleagues in the other part. My topic is, as you see, very difficult. It's full of illustrations, and I'm going to speak in a very late afternoon, after those beautiful lectures that we had this evening. So I'm in a precarious position. Anyway, I will try to stimulate your interest because I love Leishmania, and I've been working with Leishmania and with all parasites that are in Africa on tropical, in regard to tropical medicine. My specific point is the interaction between HIV and Leishmania. This is a very interesting topic, HIV and Leishmania interaction. This is the only parasite which closely interacts with HIV and kills the patient actually. So HIV and Leishmania means almost the mortality rate is very high because they did something wrong. Anyway, I will just say something on the introductory part. And because of this special relationship with HIV actually potentiates the number of the virus, which we call viral load, to increase. And HIV, on the other hand, also helps the Leishmania parasite to multiply in the body manifold. This is called the unholy alliance. The unholy alliance of HIV and Leishmania to kill the human being and destroy ultimately. And because of this, the response to treatment when there is a co-infection between HIV and Leishmania is very low. And most patients, they don't almost respond, but we try to treat them again and again because of the high relapse rate and ultimately die. So this is a very big project if somebody is interested in HIV and Leishmania co-infection in Ethiopia. Why in Spain? Because Spain is one of the countries, special countries, which have in the past, now this problem has markedly reduced, but in this Mediterranean littoral, Leishmania Spain stands first in infection with Leishmania. So you have the experience, you have the expertise, and in Ethiopia now Leishmania is growing actually. Co-infection with Leishmania and HIV is growing. The first report of HIV and Leishmania interaction in Africa was in Humera first in Africa. That means in Ethiopia. We have some clinical experience, but the mode of diagnosis and also clinically only. And the drugs are not much there as in Africa. The difference between Ethiopia and these Mediterranean countries, it is not only Spain. We have it in France, we have it in Italy, because Leishmania in these countries is transmitted by our best friend of man, by the dog. and the species is different. Leishmania infantum is in Europe and in the Middle East, whereas in Ethiopia and India it is Leishmania donovani, transmitted by whom? By the female sandfly called phlebotomus. And phlebotomus martini, for example, in Kenya, and there are different kinds of these sandflies. So this is a big So because of this, because of the intermediate process in L. donovani, the offending organism, which is here actually, this is an intracellular. It is an intracellular organism, and the infective organism is a mastigote. Actually, it has two phases, a promastigote and a mastigote, to make sense, two species. Before infection in the sandfly, it is in the form of flagellated Leishmania, that means, and it is called the promastigote. The promastigote. Anyway, it suffices to say one has tail, the first infected is with a tail or flagella. The other one is without flagella that you see here, intracellular. The promastigote transforms into a mastigote and multiplies by simple division, binary division. So this is the major form, and there will be an excellent collaboration if we try to study this and try to alleviate the problem there. So this is the promastigote. This is the infective organism, okay, you see. But here it is extracellular. It's outside the macrophage. Usually it is within the macrophage. As you can see here, this is the macrophage we have one. But these are just for demonstration. The macrophage has been crushed probably. And this is what we see. All this that you see, we can see the highest concentration of this organism for diagnostic purpose is in the bone marrow. So you have to do a bone marrow. The second site where you have this kind of organism is in the liver. So you have to do a liver biopsy. No, the highest is again in the spleen. So you have to do a splenic function to make a diagnosis. But in the field, it suffices to do the bone marrow, and you can cultivate as high as 70%, 80%. In the liver, again, about 60%, and in the spleen, as I have said, about 95%. And then you could take the blood in the blood, centrifuge it, quantitative blood count it's called. You could centrifuge it by 2,000 meter per hour, and then you could get it in the so-called buffalo, in the supernata of the test tube. If you take that, and about 10% can be extracted straight from the blood concentration. But you can get it anywhere, from the rectal slit, or from the liver, or spleen, or bone marrow. So this is an organism that disseminates to all parts of the world. So I would say something about the co-infection of Leishmania with HIV. What is the cause of this unholy alliance? The pathophysiology of Leishmania HIV co-infection is very complicated, but it is taken as a paradigm for all parasitic infection as the best model, as the best interaction. And how strongly they work together to be effective. So visceral leishmaniasis, also known as Kala-Azar, is a systemic parasitic disease caused by Leishmania donovasi species complex. This is for Ethiopia or for Africa. So I'll give you some data about statistical data. An estimated 500,000 new cases of VL occurs annually. L. donovani is the predominant parasite in East Africa and South Asia. Via the sandflies, the predominant mode of transmission is anthroponotic. What anthroponotic means is it is human to human. L. donovani is human to human, whereas L. infantum is dog to human. So wherever there is dog, L. infantum survives. That's what we know. But until recently, Leishmania infantum has not been reported in Ethiopia until 3 or 5 years ago. That is a new change. That means a new foci has been developed recently in the northern part of Ethiopia, where we think that L. infantum has been implicated. And some people have suggested that dogs are probably the cause of this infection. So the parasite, the fly is the predominant, but human with VL or post